where we have an update on the health sector paralysis in Kenya's public hospital, which now enters day 4. Striking doctors have now cut off engagement with government as talks aimed at hammering out a deal collapsed yet again. The doctors who claim the government is engaging in a cat and mouse game rejected an offer of 50,000 shillings pay increase as President Uhuru Kenyatta urged doctors to return to work. The doctors walked away from the negotiating table as the Employment and Labor Relations Court ordered union officials to appear in court on Tuesday next week for disobeying a court order outlawing the strike. President Uhuru Kenyatta finally broke his silence.
Lakini jameni, tuwe watu ambao watakuwa na huruma na maisha ya wananchi. Why should we have lost over 14, close to 20 people already? Kwa sababu sasa hata mkisikilizana yale maisha, jameni, mutafufua.
The government has been negotiating in bad faith. We came here for a meeting from the morning up to now. They're not telling us anything. They are taking us in circles.
The sooner that the government gets its acts together and comes up with a package that is acceptable, the better for us.
When a government enters into an arrangement and it signs off through a negotiated process, it is only important that you live up to what you have committed.
And now joining me in the studio to have that conversation regarding the doctor's strike is Professor Lukoy Atwoli, who is the National Secretary for the Kenya Medical Association. Good morning, sir, and thank you for joining us this morning.
Thank you very much.
Good to have you here now.
Thank you.
This, of course, is the health sector in dire straits, and headlines seem to be taken by both the government and the doctors. Do you see a way forward today?
Yeah.
Is there a light at the end of the tunnel?
Yeah, so we at Kenya Medical Association are extremely concerned that things are taking the turn that they are taking. And in the course of the day today, if things continue the way they are going, we will be constrained to declare a national health crisis. And when we do that, then it will be incumbent upon us to get involved and put together a team to resolve this crisis. Mm-hmm. The simple reason is, instead, this is an agreement that the government signed with the union 3 years ago. In those 3 years, we have not seen any moves towards implementing that agreement. The union gave the government 21 days notice. The government ignored it until the last day. That's when they started making moves, going to court to try and stop the strike. It is dishonest. We think it is time that we took the lives of Kenyans seriously, and we, as the Kenya Medical Association, think that the government is not acting in a manner that demonstrates that they are serious enough. People are dying in hospitals, as the president has pointed out. And it is the responsibility of the government to prevent people from dying from preventable deaths. And so they must come to the table. They must make a credible proposal to implement the CBA that the government signed. You know, legal tender in Kenya is signed by the government. We use money because the government guarantees it. Now, if we stop trusting the government's signature, then this country will go to the dogs. So the government must come down, sit with the union, and work out a mechanism of implementing the CBA that the government signed. So if they do not do that, what it says to us in the Kenya Medical Association, what it says to us as Kenyans, is that the government doesn't take the health of Kenyans seriously.
Now, did you anticipate that talks would take this long when you were going on strike? What is it that you expected at the point where you're going on strike?
As a matter of fact, I did not expect that doctors would go on strike. When they issued the notice, I expected the government to set up a high-powered team to sit with the union and to discuss implementation of the collective bargaining agreement. I did not anticipate or expect that doctors would go on strike in this country ever again after the signing of that CBA.
The CBA of June 2013.
June 2013, and it's a binding agreement. It was meant to be registered in the industrial court. The employer is supposed to do this. They did not do that. It's supposed to be registered by default. If the employer doesn't do it, the union gave the government time to consult and do whatever they needed, 3 years. And now they gave 21 days notice, and the government did not do anything about it.
So from where you're seated, you feel you've done all that you needed to do for that to be implemented?
So I think the union has done everything that they need to do. And the fact that they are still having an impasse with the government suggests that there is a problem. that now Kenya Medical Association needs to come in and inject some ingenuity in resolving this crisis. Because clearly, the government is not discussing the CBA with the union. The union wants the government to discuss implementation of the CBA. We can get in there and help them to find a way, a path to stopping this strike and getting the doctors back to work.
All right, so what's the plan now from Kenya Medical Association?
So the Kenya Medical Association intends, if this crisis persists, if people are not able to sit and talk, the Kenya Medical Association intends to initiate a process of setting up a high-powered national team that brings together the Council of Governors, the Intergovernmental Coordinating Committee, the national government, Ministries of Health, Finance, the Doctors' Union, and the professional associations. Bring them to the table, take less than 1 day, and we come up with an agreement that will resolve this crisis. So if this afternoon, this crisis persists, if they're not talking to each other, we shall initiate moves towards setting up this team, set aside 1 day, and resolve this crisis once and for all.
So are you saying that this is something that can actually be resolved in a day?
Absolutely.
Now, given that we're on day 4 of the strike, why not go ahead and do that now and resolve it? Because if we're waiting for today afternoon, like we waited yesterday afternoon and the day before, Kenyans are dying.
Yeah. So the Kenya Medical Association's National Executive Council will meet today, and after they meet, we will issue a resolution in which we will declare a national health crisis. And it's only after we declare a national health crisis that we can set in place activities to resolve it within the day. We do not want Kenyans to go to bed tonight with doctors on strike. We believe the president wants this strike to end. We believe the union wants this strike to end. We believe any right-thinking Kenyan wants this strike to end. And we have placed ourselves at their disposal to end this strike before Kenyans go to bed tonight.
Would the declaration of the crisis that you're talking about be before the private sector comes in? Because I'd seen a statement, if there's no agreement, then even private hospitals may have to suffer.
So absolutely, we do not want to see a situation where private hospitals are also closed, because that will be hell for everybody. We want to prevent this crisis from escalating further. And Kenya Medical Association speaks for the entire health fraternity when we say that this crisis has gone far enough. It is time for us to get to the table and resolve this thing once and for all, and ensure that no single life is lost again
Of the
today.
doctor strike.
Yes.
Okay, now once, if at all, it's going to get to that point where you declare national crisis and that kicks in, what is it that is going to be the objective of that Council of Governors and all the leaders, stakeholders, let me call it. What will be the objective of stakeholders? Is this purely the CBA?
The objective is to come up with a mechanism to implement the CBA that was signed by the government in 2013. And because I do not want us to have a situation where I go and sign an agreement with the government and I do not believe the government will implement it. That is anarchy. And we are not going into anarchy in this country because we have a government, we have cabinet secretaries, we have systems in place. So once the government signs an agreement, we want the people, we want everybody concerned to be able to trust that the government will implement it. We are coming in to help the government to find a path towards implementing the CBA. Because once that is implemented, we will restore the trust of Kenyans in the government's ability to keep its promises. And I am sure today that the government does not want to be seen as an institution that makes agreements cheekily, in a way that let's end this crisis, but we will not implement what we are saying.
Okay.
Because whatever offer they put on the table, the union must be confident that the government will implement it.
Currently, do you think there's trust between the union and the government?
There's absolutely no trust.
What is going to build that trust? Because if there's no trust right now, what difference will it make if you sit down and still sign? I mean, they signed in 2013.
Yes. So the Kenya Medical Association sits in a unique place. We sit in a unique place where, throughout our history, we have demonstrated our ability to carry out our resolve. The union trusts us. The government, we have demonstrated to the government that we keep our word. When we tell the government that Kenya Medical Association will do this, we do it. And therefore, they have no reason not to trust Kenya Medical Association. So the Kenya Medical Association will sit in the middle and extract promises from both sides that will ensure this strike comes to an end. The ultimate goal is to ensure that an agreement signed by the national government is implemented in a manner that doesn't cause Kenyans to suffer. So, of course, we do not want a situation where the government sets aside the entire budget and says this is going to help. Of course, that's not going to happen. But to implement this CBA, it will take less than 10 billion Kenya shillings. We have a budget of 2.1 trillion Kenya shillings, half of which we don't know what it does. It gets lost somehow. 10 billion. I think putting 10 billion and putting it on a scale to balance against the lives of Kenyans who have nothing to do with this is wrong.
It's completely wrong.
This is something that can be sorted out in a day. In fact, in an hour, sitting at a table, honestly engaging, being civil with each other, not threatening each other. This is something that we can get a resolution within an hour of sitting around a table.
All right, and now, given that that's the situation and that's the way it is, apart from the remuneration, what other issues are you crying out for as doctors?
Well, if you remember, after the last big strike in the health sector in 2012, which resulted in this agreement in 2013, we set up a team called the Musimi Task Force, which brought together all government agencies and doctors involved in healthcare. And this task force made a comprehensive report that addressed everything in health. And if we had implemented that in 2013, today, 3 years later, this country would be a sterling example to the whole world about how to turn around an ailing health sector. We talked about human resources for health. We talked about financing. We talked about equipping hospitals. We talked about legislation. We talked about policy. And it's all in that report, which is gathering dust in shelves in the Ministry of Health. If somebody just takes a step back, looks at that report, and implements each and everything that was put in that report, this crisis would be non-existent. Because we included remuneration of all health workers, not just doctors. We included training of health workers. We included all the cadres, because everybody was involved. And if this had been followed through, we wouldn't be having the crisis we're having
what
today.
we have now. As I was speaking to Dr. Nyikal earlier on, he mentioned that at some point in Kenya, you'd even have patients moved from private hospitals and referred to public hospitals.
Absolutely.
Where did we go wrong?
We went wrong when we changed our priorities. We shifted our priorities. I believe people elect governments to guarantee very few things, and health is one of them. Health, education, infrastructure, and security. If a government can guarantee those four things, that government can rule in perpetuity. So we elected all the governments since independence in order to, among other things, guarantee the health of Kenyans. So when the government stopped prioritizing health as an important thing for the government and for Kenyans, that is where we went wrong. Because in any civilized country, we pretend to be a civilized country, but in every civilized country, health is non-negotiable. Everybody is guaranteed health because people recognize that a healthy population is a productive population. You cannot achieve any economic growth targets with a sick population. And how do you achieve a healthy population? By getting the right mix of human resources, remunerating them properly, and giving them the tools to ensure that the health of the people is taken care of. If you put that as number 2, number 3, number 10 of your priorities, you have it all wrong. Absolutely.
All right, and let's bring in now Kenyans and anybody else who's watching. And here's our Twitter poll question this morning. Should Kenya's health workers be compelled to return to work on humanitarian grounds? This is the question that we'd like to interact with you. Should Kenya's health workers be compelled to return to work on humanitarian grounds? And it'll be interesting to hear what your take is.
I think from the day I trained doctors in Eldoret at Moi University, and when they graduate, they take an oath in which they promise to put the health of their patients above all else. We have been doing this historically for thousands of years since the Hippocratic Oath started being taken. The oath does not say that you will treat people when you are sick yourself. The oath does not say you will treat people when you're hungry. The oath does not say you will treat people when you didn't sleep last night. So whoever requires these doctors on humanitarian grounds to serve Kenyans must ensure that they're equipped to do so. So if I do not know any Kenyan who wants to be treated by a sick doctor, he will make mistakes. He'll kill you. You want to ensure that the health worker who's taking care of you is healthy, is well-fed, is well taken care of. 20, 30 years ago, a doctor could get onto a Kenya bus anywhere in this town and go to Kenyatta National Hospital. And as long as he has that ID, nobody would ask him for money. A doctor had privileges. A doctor would be housed in the hospital where he's working. her doctor's bills would be taken care of. Therefore, this doctor's mind was at peace. This doctor would leave his house, go and see patients and think about nothing else. Today, they are paying rent, exorbitant rents. They are taking their children to schools expensively.
Okay.
They are getting sick. They can't afford care.
Final question before I let you go, Professor Lukoy. If there's no resolution found this afternoon, how much time would you give what you talked about, declaring the a disaster crisis, setting up this committee and having a solution? How much time should we give it, do you think?
If, after we declare the crisis, and we call these people on board, and they all come on board, and they are willing and ready to resolve this crisis, the day will not end without a solution. So the condition is that the government, the county governments, the doctors come together in an atmosphere that we want to resolve this thing today. If that happens, we are willing to mediate. The day will not end without a solution.
Without a solution.
But if, especially the government, is unwilling to get involved in this process, then your guess is as good as mine as to how long this is going to take.
All right, thank you very much, Professor Lukoy Atwoli, who's the National Secretary for Kenya Medical Association. Thank you for your time.
Thank you.
All right.